was going to an ultrasound, and what I'm looking to see is how much inflammation is in the ankle joint, and if I can pick up the ankle ligaments to see whether there's been any damage to them during her trauma. So you have, it looks to me like you have, there are 3 ligaments that hold the outside of the ankle together. Looks like you've torn the first one and the second one. Their names, they're obviously technical names.
Yes.
I'm not gonna bore you with the names, but it looks like you've torn the ligaments, which is not a surprise because of the avulsion fractures. Right. So I mean, it kind of confirms what the X-ray shows. Let me take a look on this side. This is going to be kind of a long haul of recovery for you. Yeah, there's not nearly as much swelling or fluid around the ankle joint on the medial side. These ligaments appear to be intact, but I definitely have some concerns about the ones on the outside of your ankle. So when we talk about ankle ligament injuries, and there are different grades of those injuries: grade 1 sprain, grade 2 sprain, grade 3 sprain. Grade 1 is just a gentle pull of a strain, if you will, of the ligament. Grade 2 is a partial tear. Grade 3 is complete rupture of 1 or 2 or 3 of those ligaments. Looks to me like you probably have a kind of a grade 2 plus, where you've got, a tear of 2 of the ligaments, but I don't think they're completely ruptured. The good news is that in most cases, they'll go on to heal uneventfully. There are times when they don't. And when they don't heal, you're left potentially with what we call a chronic unstable ankle, which is an ankle that has too great a range of motion and is kind of, to lack for lay term, wobbly. And that's a setup for early arthritis and potential ankle fracture at some point if you were to twist it again. Those are patients that I talk about doing surgical repair of those torn ligaments. Not sure you're in that category. What I'd like to do and recommend to you is that we absolutely keep you in that boot. If you didn't have one, I'd put you in one today. I'm going to recommend that you use a lot of ice a lot of times a day. And I think physical therapy would be really helpful to you, where you go to therapy 2 or 3 times a week for probably about 4 weeks. And then I would want to see you back again in 3 or 4 weeks to kind of evaluate and see what you're doing and how you're doing and where you go from there. The scooter is great. I would probably say, use that certainly for the next 10 days, as much as you can. Try to really minimize your weight bearing and then figure it out from there.